Hi, I'm Dave Worzel, and you're watching PHTV4 Living Well. On Living Well, we look at a variety of topics related to living a healthy lifestyle. And today we've got Dr. Brian Gambla here from Gambla Dental in Palos Heights, and we're going to take a look at dental care. And today's topic, and we were talking earlier, today's topic has caused me to brush my teeth more than I had been. If I was like in a morning at night guy, now I'm sneaking in a third, fourth, and fifth one during the day. We're going to talk about gum disease. Periodontitis, I think, is the name.
Yes.
Right? Dr. Gambla, thank you for being here. Can you tell how long have you been a dentist? How long have you been in Palos Heights?
I've been a dentist for 33 years. Been
Wow.
in Palos Heights 11 years now, and I was in Oak Lawn for 22 years, so I've been practicing a long time.
All right, so you're bringing a lot of
So it's good.
expertise. Yeah, a lot of expertise, a lot of experience to this one. All right, so first, I think we understand we have gums and sometimes they hurt. We can have a variety of problems. Can you kind of clarify or define better for us what is periodontitis or gum disease?
Gum disease basically is inflammation of the tissue. You can get into gingivitis, which is inflammation, but then periodontitis is when you have inflammation in the presence of tartar or plaque, and then also you get bone loss, which holds the teeth in place. So each level has a different degree of severity.
Okay, so when you said bone loss, it kind of
Rattled you, yes.
The red flag went up on that one. We start talking about our tissue and if it gets inflamed. And so how about, how would I know if I have
We'll
some
give you
type
the
of gum
basics. The basics are you have redness in the tissue. When you brush, the tissue bleeds. So that all these things are not normal aspects of brushing your teeth. You should not have bleeding after brushing.
Okay. Now, how quickly do I need to go to the dentist on this? Like, is it, no, just keep, all right, start rinsing or brushing your teeth more and it'll go away, or no, this is something that needs to get treated?
This is something that needs to be treated. The whole key to this, the process is with maintaining or taking care of the teeth and preventing gingivitis or periodontitis is going to the dentist on a regular occasion. What happens is we're able to kind of ward off or head off anything that's going to happen that is untoward. So the bottom line is you really want to just be consistent with your cleanings because it can prevent a lot of different problems.
Okay, so let's do the worst case scenario. Let's pretend I am not the good dental patient. All right. What are the risks if I don't get on top of this the way I should? I don't see a dentist,
The risks are kind of sometimes more immediate. You could have, as we said, bone loss with the teeth, and that teeth start to get loose. You can lose teeth. You can also have problems with just the heart. You get infections, and that travels through your bloodstream. So there's a lot of kind of silent killers that occur.
This is potentially way more serious than like, oh, my gums are a little sore, or I've got a little bit of bleeding here.
Yes.
It can
yes.
lead down a pretty bad road. So I want to come in for two directions. One would be, all right, let's say unfortunately I do have some type of gum disease. How do I treat it, or what's the cure for it? And then the second part I'm going to say is, I don't even want to get to that point. What's the preventive stuff, which I think we've kind of talked about. Let's talk about the cure first, or the treatment.
Okay, treatment would be you go to the dentist, we measure the gums, see or try to monitor what the health of the tissue is. If we're going to treat something like periodontitis, we would freeze an area, clean it out more aggressively, still a closed procedure, not a surgical procedure. And try to get everything clean. So I always use the analogy. It's like driving your car. Normal car usage, you drive down the street, car gets dirty, you go to the car wash. That would be analogous to a cleaning. If you're four-wheeling in your car and there's mud all over the place, that's basically where periodontitis would come into play, where you need something more aggressive than just a cleaning.
Just a wipe down.
Yeah, exactly.
Okay. Now, you said this can involve, if I get an infection in my gums, could I end up on antibiotics because of this?
Absolutely. You can get what they call a periodontal abscess, which is infection. And yes, we put patients on antibiotics. There's a lot of stuff that can kind of travel through the bloodstream. it really is just an unhealthy condition at
Okay.
the end of the day.
So now I feel like as soon as we're done here, I want to go brush my teeth. Maybe that's, I hope not necessary. I mean, regular brushing, regular flossing, regular cleaning, regular dental.
Normal
How to prevent it,
dental
that's what I'm
health,
talking about.
yes. If you're brushing, flossing, rinsing, and then having regular checkups, you should do very well with that approach.
Okay.
Sometimes the frequency or the interval changes depending on the person. Some people, they can go 6 months, everything's good. Other people are at 4 months, other people are at 3 months. It all depends, and your dental provider will be able to kind of give you a better assessment of what is best for you.
Now that, as you're saying, I'm thinking, yeah, that makes perfect sense. We don't all function the same way. We're not all living on the same diet. We're all not, genetically exact in our enamel and our tooth and our, similar.
Similar, but not, as a rule, everybody's kind of different.
Right, okay. Dr. Gambla, thank you very much. I'm going to be taking better care of my teeth, so at the very least, thank you for that. And thank you for the information on how to manage and deal with gum disease.
Thank you.
I'm Dave Wurzel, and you've been watching PHTV4 Living Well, and on Living Well today we've been taking a look at dental care related to periodontitis, talking with Dr. Brian Gambla. Thank you for watching.